coming back to inflammation, because that's what we were talking about. So it has been defined for us that response of the body's immune system to harmful stimuli that has been introduced. So it's a coping mechanism for the body, or a protective response, just trying to get rid of the causes of cell injury and what can easily result to necrotic cells of the body. So purposes of inflammation, usually it has a variety of physiologic and pathologic responses. Usually it's intended to eliminate the initial cause of cell injury, remove the necrotic cells, the damaged tissues, and also facilitate the generation of new tissues. I'm sure from your physiology, you've already talked about this, some of those mechanisms, the phagocytosis and the rest. So usually now inflammation is the one between being a repair process that replaces damaged tissues and also helps to remove the residual defects of fibrous scar tissue and the various toxins. We have the causes of inflammation. We have the exogenous, the endogenous causes. Exogenous, those are external causes. Endogenous, the internal causes. Exogenous, like physical agents, like in cases of fractures, in cases of burns, in case of freezing, exposure to chemical agents, toxic agents, the acids and such like, the exposure to biological agents, the bacteria, the viruses, the parasites, all those that have been introduced, as long as they are foreign to the body, those are exogenous causes of inflammation or an inflammatory response. Then we have the endogenous causes, like in cases of circulation disorders, like in case of thrombosis, where a thrombi has formed and it has obstructed blood flow. Cases of infarction, where a given tissue of the body is not receiving sufficient of the oxygenated blood. Cases of hemorrhage, enzyme activation, when sometimes some enzymes have been activated in response to a condition in the body. Metabolic products, we know those products of metabolism. The uric acid, the urea, they usually affect the normal cells of the body and they can easily lead to an inflammatory response. We have those signs of inflammation. We have the 5 cardinal signs: the rubor, the tumor, the color, the dull, and the functionalizer. That is redness, swelling, heat, pain, and loss of function. Those are the 5 cardinal signs of inflammation. Sometimes patients can present with all these signs, or sometimes some patients can just present with a part of these signs. The redness, usually we want to look at what are those physiological mechanisms that now lead to the production of those 5 cardinal signs. When you get to see those cardinal signs, what are the physiological changes that have happened to the body that have led to the presentation of those signs? So with redness, usually as a result of vasoconstriction, which now leads to, of course, the various chemical mediators being released, and those vasoactive inflammatory mediators, which are of inflammation, which are released, which now present with redness around the area of inflammation. Of course, there'll be perfusion that will be presented to the area where there is that inflammation. The swelling, because of increased hydrostatic pressure and also increased permeability of vessels as a result of inflammatory mediators which are sent. And that leads now to formation of exudatives, which now cause the swelling around that area. The heat, of course, with increased blood flow to the area where there's an inflammatory response, there will be increased now heat around that area, because it will be increased metabolic activities around the area where there is an inflammatory response. Pain, because of the irritation of those neural endings around the area where there's that inflammatory response. Now, the irritation of the neural endings, which is caused by the inflammatory mediators like the prostaglandins, which the prostaglandin substances like the bradykinin, which again now cause irritation to the neural and so the nerve endings around that area, and that causes the pain. There could also be because of compression of nerves by edema, because remember that there will be increased blood flow to that area, there will be edema. So with increased edema of that area, it can now compress the nerve endings, and that can cause the pain. Could be because of acidosis, developing acidosis around that area, more especially in cases of chronic inflammation. Loss of function, usually caused by pain and edema, which now disables that area and affect the movement of the involved body parts. So those are the 5 cardinal signs of inflammation. Any question to that point? Any question? Are we following?
Yes.
Okay, thank you. If we are following, then we can now proceed. The next one you're talking about is the phases of inflammation. We have the first one, the hemodynamic or vascular phase, or the initiation phase. Usually, the vascular phase has a main goal. Usually, its main goal is to detect damage and prepare an immune response for the body. So, usually, what happens during the hemodynamic or vascular phase, the key events here is that there will be vasodilation. That means now that there will be increased blood flow to the area. The increased blood flow, of course, is going to cause the heat and the redness, some of the 2 cardinal signs that we've just talked about. Then there will be increased vascular permeability, the plasma proteins and also the immune cells now leaking into tissues, and that's going to cause swelling, another cardinal sign of inflammation. Then, of course, that's what we're talking about there. So that's usually what happens during the vascular phase or the initiation phase or the hemodynamic phase. There's an increase of blood flow, changes in the small blood flow or the small blood vessels of microcirculation. So they get to vasodilate, and that means that now it will increase blood flow to that area. Then the second phase is the cellular phase. The cellular phase, or which called as the amplification phase, this one it has a main goal of now recruiting immune cells to eliminate now the cause of injury. That is the main goal of the second phase, the cellular phase. So it recruits immune cells to help now eliminating the causes of injury. Some of those things that will happen there now, of course, will be leukocyte recruitment. So the neutrophils will arrive fast towards now the site via the chemokines. Phagocytosis will also take place. Phagocytosis, I know from your physiology, you know what phagocytosis is. once the neutrophils have been recruited to that place, now uh, the neutrophils and the macrophages will engulf the pathogens and also the debris of that injury. And then now there will be release of the cytokines, which now will now sustain inflammation and also recruit more cells. So the release of those chemical mediators and ensure that now they have eliminated or they have engulfed the pathogens and also end debris that is within the site of injury. So that's what we're talking about here. Still, that's part of the second phase, leukocyte margination and the endothelium and the addition to the endothelium, where now, of course, there is the delivery of the leukocytes to the site of injury, so that now they can perform their function of being the host defense. And usually they do this by the process of phagocytosis. You know that through your physiology. So usually can be divided now through those steps: the endothelial activation, transmigration, chemoctasis. You know what that is, all that is. Um, the endothelial activation adhesion, where they attach themselves now to the endothelium, and then they transmigrate, move to the site of injury, and then now engulf the injurious agent. Then, of course, activation and phagocytosis. It can always use the various processes of phagocytosis, where now they can engulf the injurious agent. A phagosome is formed. Uh, the chemical mediators are released and they kill and degrade the microbe before it's eliminated from the body. Then the third one, I think I'm not saying it here, is now resolution and the chronic progression, where now, of course, with the resolution of the clearance of those inflammatory cells and mediators, and then tissue injury or tissue repair will commence. So those are the phases, the three phases of inflammation. We have the types of inflammation, the acute and chronic inflammation. Um, who knows how to differentiate acute and the chronic inflammation? How can we be able to differentiate acute from chronic? So when we talk about acute inflammation, we're talking about inflammation that is of rapid onset. So usually, okay, thank you. So some of those, yeah, so the chemical mediators of inflammation, I know we know this. Usually, we talk about the chemical mediators. Those substances are released now by the immune cells, damage tissue plasma proteins. They just help orchestrate and regulate inflammatory response. So they are just there to initiate, to amplify, and resolve inflammation. We have those as derived from cell-derived mediators, which are produced by the site of inflammation, and they are stored in granules. So, like the histamines, which are released by mast cells, basophils, and platelets. So the histamines will cause vasodilation and also increase permeability. We have those lysosomal compounds, which are released by neutrophils. They also increase vascular permeability. We have the cytokines, which regulate leukocyte activation and also systemic responses. We have the prostaglandins, which are produced by the uh, the COX pathways from the arachnoid acids, and they are usually involved in vasodilation, in fever, and also in pain. We have some that have not just included, like the platelet acting factor, which are involved in leukocyte adhesion, chemotaxis, and also vascular um, permeability. So some of those uh, chemical mediators. Usually now they usually use those systems, those four interrelated systems. The activated complement proteins, which serve as chemostatic factors for the neutrophils. You have the kinin system, usually which is activated by coagulation of factor 12, which produces now the substances that increase permeability. Coagulation system, which converts the plasma protein fibrinogen into fibrin. The fibrinolytic system, which also now contributes to inflammation through formation of plasmin, which now breaks down that fibrin into products that can now affect vascular permeability. So all those systems, of course, plus the chemical mediators, are now involved in making sure that the inflammatory response is effective. Then we have chronic inflammation, which again is type of an inflammatory response that is now prolonged and persistent. It can last from weeks to months to years. And usually, with chronic inflammation, it's caused by persistent infections, like in cases of tuberculosis, in cases of viral hepatitis. We have prolonged exposure to toxic agents, like tobacco smoking. Some of these autoimmune diseases, like in case of the rheumatoid arthritis, which are a bit prolonged, or chronic irritation, like in cases of ulcers or foreign bodies. Some of those causes of chronic inflammation. Some of the cells involved now in chronic inflammation process, the macrophages, the neutrophils, the lymphocytes, and we know what these cells are and their respective responsibility, more especially in response to chronic inflammation. But the main thing here is um, the macrophages, which of course will release, which are the most dominant ones, and they release the cytokines, they release enzymes, and also the growth factors. The lymphocytes, which will mediate the immune response, um, and such. So, differentiating chronic inflammation and acute inflammation, you know, acute inflammation lasts for a short duration compared to chronic inflammation, which lasts for a longer duration. So you can see here, the onset acute is fast, chronic is slow, it's insidious, takes time. Cellular infiltration with acute inflammation, like we said, mainly is the neutrophils, which are involved. They can also be the macrophages, but with chronic, we have the monocytes, the macrophages, the lymphocytes, the fibroblasts, and these giant cells are involved. Tissue injury and fibrosis, or the tissue damage, usually in acute, it can be mild and self-limiting. In chronic, it can be severe and usually be more progressive. If there are any local and systemic signs involved with acute inflammation, there is prominence of appearance of the local and systemic signs. The fever, which is the most common sign of an acute inflammation. So the fever, the headaches, the pain, they could always be manifesting. Um, in chronic inflammation, they are less prominent, but they may be subtle. That is, they may appear in uh, not more pronounced, though it could be in acute inflammation. The mediators involved, the kinins in acute, the complement prostaglandins, the T cells and macrophages involved in chronic inflammation. Characteristic lesion involved here. In acute inflammation, you will see abscess formation, but in chronic, there can be a granuloma. Any vascular changes, vasodilation, increased permeability in response to acute inflammation. Angiogenesis can be seen now in case of chronic inflammation. This is because of now the continuous tissue repair. Necrosis is absent in acute inflammation, but it will be present in chronic inflammation.